Good afternoon, and thank you everyone for joining us today for our coronavirus digital discussion. It's a series of one-on-one interviews dedicated to the pandemic. We bring them to you every Monday right here on WAVY. So the pace of vaccinations is picking up. More people are getting out and about, a little bit back to a little bit more of a normal life. The question is, have we gotten back into this too soon? Are we possibly on the precipice of another surge out there? That is what Dr. Anthony Fauci has been talking about this weekend. So joining me this afternoon is infectious disease expert, Dr. Edward Oldfield with Eastern Virginia Medical School. Dr. Oldfield, it's wonderful to see you again.
Thank you. It's good to be here.
Thanks for joining us. So let me ask you, did our country open up too quickly and try to get back to normal too quickly?
Well, I think that that's true. We've come way down from the peak cases and deaths in early January, very significantly down. But what happened then, we hit a plateau and it didn't keep going down. And that plateau is actually above the level of the peak in the summer, which is not good. And the other piece of bad news is in the last 2 weeks, cases have gone up 11%. And if you look at the state of Virginia, we're actually higher now on our plateau than the peak in August. And of course, you know that we had a peak in Virginia in August. Most of the cases were from Eastern. Mm-hmm. Now we are slightly less than our peak in August, but that was our worst time up until recently. We were seeing about 450 cases on a 7-day average. We're now at 330. So we're not a whole lot better than we were at the peak in August, which was not good. And we're seeing the numbers starting to go up. So it's really the other piece of news that is not good is these variants that are coming in. And in particular, the United Kingdom strain. And the United Kingdom strain now makes up about 30% of all cases in the United States. It'll be over 50% by the end of early next month. And this particular strain is 50% more infectious than the old strain. And it looks like about 50 to 60% higher risk of dying if you get it. So
does it look like this one is the problem? Is that why we're seeing more cases right now, because it's so much more contagious, do you think? And is the vaccine effective against it?
The vaccine is fully effective. All 3 of the vaccines we have, the Pfizer, the Moderna, and the Johnson & Johnson are all fully effective. So that is not the issue. Also, if you had the old strain of COVID, you're still immune from the UK strain. The issue with the UK strain is it's more infectious and it's more deadly. So right at a point where we were really starting to get great success, we got on this plateau. Now I think we're loosening up too quickly and we're starting to see cases come up. And if it's this strain and it gets more, I think we could be in trouble. We could be looking at another surge. Now, on the other side of the coin is the good news about vaccination, because the more people vaccinated, the less spread there's going to be. And right now in Virginia, a little over 2 million people, about a quarter of the population have had 1 dose, and about a little over 1 million are fully vaccinated. And I think you know our supply of vaccine is markedly increasing. Virginia's going to get 165,000 first doses of Pfizer or Moderna and 250,000 second vaccine doses, plus about 50,000 J&J, Johnson & Johnson, and over 200,000 to pharmacies. Plus, I think the listeners may have heard that FEMA is setting up a vaccination center at Military Circle where they're looking at doing 3,000 a day. So what I would say is we need to keep all of our precautions, be careful about this UK strain, and keep wearing your mask, keep social distancing until we get more people vaccinated. it
Let me
looks
back up.
like,
Let me back up for just a minute. Let me
Sure.
ask. Let me ask about. You think we've opened up too early? And across the country, we've seen some states that have just opened up everything. They said no more mask mandate. Everybody's back to 100%. Here in Virginia, we haven't done that. So, do you think that we have been more responsible? And if we have been more responsible, why are we also seeing this bit of an increase?
well, I think we have been more responsible than Texas, and I keep watching daily to see whether Texas is going to have a surge because they've opened bars. But if you look at videos of Virginia Beach or spring break, the young people are not wearing masks. They're not social distancing. So I think that's what the issue is, even though the state and the governor have been moderate in loosening restrictions.
Mm-hmm.
There are a lot of people that are not following wearing masks.
Let me ask you about the young people then. So some of what Dr. Fauci said this weekend, and we looked about a surge. A lot of the cases that we're seeing now are in younger people. I think it was between the ages of like 10 and 19 or 10 and 29. So if those are the people who are being diagnosed, but they're also the people who don't have such severe outcomes. So if we do see this surge, and we know that many of the people in the older population, the at-risk population, have received their vaccinations, is it as big a worry as it would have been, say, a year ago? Because this vulnerable population has been vaccinated and the younger people just don't get as sick?
That is true that it's not as bad as if this happened last year. Essentially all the nursing home people have been vaccinated. People over 65 have, but there are still many, many people under 65 with diabetes, obesity, comorbidities. The other thing we're seeing more and more is long COVID. And it turns out that the major group that gets attacked is middle-aged people seem to do worse with this long haul COVID. And I'm talking 2, 3, 4, 5 months of disabling symptoms. And for that group, from I think it's 20 to 49, about 30% are going to suffer long COVID. So your initial episode may not be bad. In fact, you can have an asymptomatic infection and then end up with long COVID 2 months later.
And what are the major symptoms that you're seeing with long haulers or with the long COVID?
So a lot of people will have a chronic cough. They'll have very significant fatigue. And one recurring symptom is what they call brain fog. They just simply cannot concentrate. They can't get through the day. A number of people have had to change their jobs. They just cannot keep up with the pace. And, disability, you have to be disabled for a year to get disability, and they're not there. And so this is opening. We're talking about now people having to set up long haul clinics for these people, but there's no known treatment. So just because your initial case may be mild doesn't mean that you're going to get through this scot-free. The other thing, of course, is smell and taste. People not only have trouble losing their smell, but when it comes back with this, what they call parosmia, which is where a steak might smell like burned rubber. And all of your smell is off. And you can imagine how disabling that would be. So from my perspective, this is the time to continue to be cautious. Now, if you're fully vaccinated, I think that's a different story. I have no issues with people in a small group of fully vaccinated people getting inside together, having bridge indoors again, whatever. And it looks like and traveling again. But it looks like there are a certain group of fully vaccinated people that they just want to put their toes in the water. They don't want to dive in the deep end. So they're still being very cautious. And actually, a recent survey showed that about 30% of fully vaccinated people don't want to do any of these behaviors until we've got herd immunity.
So let's talk about that. When might we have herd immunity? We are really picking up the pace on our vaccinations, and the president just last week increased he now wants 2 million. people vaccinated by his first 100 days in office. Could we see that herd immunity coming much quicker than we had anticipated, say, just a few months ago?
Right. So we're doing about 2.6 million vaccinations a day. The estimate is in April, we'll do 75 million more. In May, we'll do 89 million people, and the open up the vaccine to anybody. It's estimated by mid-July, 75% of the US population over 12 will be vaccinated. And that's, with the original strain, that probably would have been enough for herd immunity. But the more infectious the strain is, the higher the percentage of immune people you have, you need to get herd immunity. So with the Wuhan strain, it would probably be 75% to 80%. With the next strain, it's probably be 80, 85. With this UK strain, we may need close to 90% of the population either immune from prior infection or vaccine.
Is that even a possibility, really? We still have quite a few people who just aren't sure about the vaccine, and they don't want to get it yet for whatever reasons they have. Possibly they think it was pushed through too quickly, they don't trust the science, or they just don't like vaccines for whatever reason. Is that even possible to get a 90% of the people to get this vaccine?
I think that's going to be very difficult. But as we start to open up, I think that a vaccination passport is going to be your ticket to get into venues, to get onto airplanes, to get into certain places. And so maybe that will be a spur. And the other thing, a lot of people, they're not saying I'm never going to get it. They're going to say I'm waiting and watching. And so the more the time goes by, the more that we see how safe these are, how efficacious they are. I think we're going to see more people being willing to take the vaccine. But we still have, I would say, at least 30% of the population that is reluctant to be vaccinated.
So that being said, when do you see a time when we can have gatherings like this, or is it only with the passport? Can we have gatherings without masks and social distancing by the end of the summer?
I think that vaccination passport is going to be critical. CDC is working on right now. Microsoft is working on one. The Israelis already have a vaccination passport because they're almost 80% of their population has been vaccinated. So I think that's going to happen. And I hope that that's going to be a further inducement, although there are ethical concerns about people that had more difficulty getting the vaccine. Are they really going to be shut out of things? So it's not just 100% positive for the vaccination passport. There's another side to that discussion, but I think it's going to happen. Certainly, if you want to do international travel, you're going to want to have a vaccination, proof of vaccination.
Do you see that as something that would be required for, say, going to a concert or a wedding even?
That's what I would think. And I would think for a cruise ship, I wouldn't be surprised if part of being able to buy a ticket is that you have proof of vaccination. So I can think of a lot of venues, a lot of type of activities that you're not going to be allowed to participate unless you're vaccinated.
Let me ask you about these masks again. You mentioned that you don't have a problem with people who are fully vaccinated coming together without masks, in a home or a smaller venue and getting together. We are still requiring masks, however, for folks in the general public who are fully vaccinated. And I think that's a kind of a question for some people now still is why? Why do I need to wear this mask if I am fully vaccinated?
The way I would look at that is if you're out and about, you're going into a store, how do they know that you're vaccinated? So I think the point is that we all ought to wear a mask, even though you're fully vaccinated, you don't need it to protect you. But what's the store going to do? I mean, they have no choice. They don't want people wandering around without a mask. And, so I think that's one reason. The other issue is we don't completely understand how good the vaccines are at preventing asymptomatic infections. All of the studies were based upon symptomatic infections. So the most recent data I've seen suggests probably 75% effective against asymptomatic infections too. And even if you got an infection, it would be lower amount of virus because of your vaccine. So you might not even be infectious, even though you have no symptoms and you're infected.
Yeah, so let me ask this, how many other vaccines that we have for so many other diseases out there, how many of them are we still able to be asymptomatic perhaps and spread a disease? Are there any?
Well, you know, off the top of my head, usually vaccines are designed to prevent symptomatic infections. And, you know, this is one of the rare viral diseases we've had where so many people are asymptomatic and so much of infection comes from people with no symptoms. You know, with SARS, the original SARS in 2003, everybody had symptoms. Now, the estimate is probably 65% of all infections come from people with no symptoms. So that's very rare for a virus to act like this. And this is why it's been such a problem. It's almost impossible to control an infection where most of the transmission is from people who don't have symptoms. You can't isolate them. They don't know to quarantine because they don't have symptoms. Very difficult.
Let me ask you this, just today also, the joint WHO China study on the origins of the COVID-19 disease say that the transmission of the virus from bats to humans through another animal is now the most likely scenario, not a lab leak. They said that is extremely unlikely. This is what you told us more than a year ago. Of course, there are still some now who say, well, of course, this was a China study. They don't want to take the blame. They're not surprised at all by that finding, but they're still skeptical. What's your response to this WHO finding and also to the skeptics?
Yeah, so it makes sense to me. The original SARS in 2003, that was a bat coronavirus that went to a civet cat. And the civet cats were kept live in restaurants until they were ordered, and it made a jump from civets to humans. The MERS, the Middle Eastern Respiratory Syndrome, is another coronavirus that came from a bat to camels, and it's camels that infect humans. So the coronaviruses we've already seen, it's been the same story. There are hundreds of coronaviruses in bats, and the coronaviruses in bats are very similar to this epidemic strain. So I would agree that the most likely scenario is that it was from bats to an intermediate animal to humans, and probably in southern China. And I wouldn't be surprised a few months before what happened in Wuhan. Although interestingly, Dr. Redfield was on CNN last night, and he posited that it was an accidental lab release from the Wuhan Virology Institute. I think that's less likely, and I agree with the WHO conclusion. And most likely it's just like happened with the original SARS and happened with MERS. Okay. Bats to an intermediate animal to humans.
Dr. Oldfield, thank you so much for your time. As always, a great wealth of knowledge for our viewers. We appreciate it.
Okay, thank you.
And thank you all for watching. If you missed any of our interview today, we will have a recap beginning this evening on WAVY News 10 at 4. I'm Stephanie Harris. Have a great day.
Thank you.